There is no shortage of foods the internet claims will unclog your arteries. Salmon gets mentioned. Garlic gets mentioned. Various berries, oils, and seeds cycle through health content endlessly. Most of it blurs together into noise that is easy to tune out. What is harder to find is a clear, honest explanation of why specific foods work at the biological level, what the research actually says about each one, and how they fit together into a single meal that addresses the root problem rather than just adding more superfoods to a list. That is what this video is. 6 ingredients, a specific reason for each one grounded in published research, and an honest assessment of what consistent eating can and cannot accomplish for your cardiovascular health. Before we get into the plate, you need about 60 seconds of biology, because once you understand what is actually happening inside your arteries, every ingredient makes immediate sense rather than sounding like something a wellness blog told you to eat. Your arteries have an inner lining called the endothelium. When it is healthy, it is smooth, flexible, and blood moves through easily. When it is chronically inflamed, from a poor diet, oxidative stress, high blood sugar, smoking, or persistent high blood pressure, that lining gets damaged. It becomes rough and sticky, and cholesterol and calcium begin collecting on those damaged spots, gradually building into what is called plaque. Here is the detail most health content skips entirely. Not all plaque behaves the same way. Hard calcified plaque sets slowly over years and is more structurally stable. Soft, unstable plaque is the dangerous kind because it can rupture without warning and trigger a clot. That clot is what causes heart attacks and strokes. The plaque sitting quietly in the wall is not the event. The rupture is the event. Understanding this changes how you think about the food. Every ingredient on this plate is aimed at one of two jobs: stop new plaque from forming or make the soft, unstable plaque that already exists more stable so it does not rupture. Keep those two jobs in mind as we go through each one. The first ingredient is wild-caught salmon. Salmon is doing something specific inside artery walls that most nutrition content never explains clearly. It is loaded with a type of omega-3 fatty acid called EPA, eicosapentaenoic acid. EPA does not simply circulate as a vaguely heart-healthy nutrient. Research has shown that EPA gets incorporated directly into soft, unstable plaque tissue inside artery walls, and once embedded there, it changes the composition of that plaque in a way that makes it more stable and less prone to the kind of rupture that triggers a clot. This is the mechanism that makes EPA specifically valuable for cardiovascular risk, rather than just generally good for inflammation. The evidence here is serious. The Reduce It trial, published in the New England Journal of Medicine, found that high-dose EPA reduced major cardiovascular events, including heart attacks, strokes, and cardiovascular death by 25% in high-risk patients. It is important to be precise about what that trial used: a concentrated pharmaceutical dose of EPA, icosapent ethyl at 4 grams per day, which is significantly higher than what a standard portion of salmon provides. The mechanism is the same: EPA stabilizing plaque from the inside, but the dose from food is lower than the therapeutic dose used in the trial. That does not mean salmon is not worth eating. It means the evidence for the mechanism is strong and the food is a genuine dietary source of the compound. 2 to 3 servings per week of wild-caught salmon, which runs higher in EPA than farmed varieties, is a consistent recommendation across major cardiovascular nutrition guidelines. Wild-caught sardines, mackerel, and herring are equally valid alternatives if salmon is not practical. The second ingredient is leafy greens. Spinach, kale, rocket, Swiss chard, and similar greens are the most concentrated dietary source of something called dietary nitrates. And what your body does with those nitrates directly affects how your arteries function. The conversion pathway is this: dietary nitrates get converted by bacteria in your mouth and gut into nitrites, and those nitrites are then converted into nitric oxide, one of the most important signaling molecules your cardiovascular system produces. Nitric oxide keeps artery walls relaxed and flexible. It signals the smooth muscles surrounding blood vessels to stay dilated, keeping blood pressure lower and reducing the mechanical stress on damaged arterial walls. When nitric oxide is low, arteries stiffen and narrow, blood has to work harder to push through, and that increased pressure accelerates damage in areas where plaque has already begun forming. A meaningful portion of leafy greens with every meal gives your body the raw material to keep producing nitric oxide continuously. Beyond the nitrate pathway, leafy greens are rich in vitamin K, folate, and antioxidants that reduce the oxidative environment that allows plaque to initiate and grow. Making greens the base of the meal rather than a small side dramatically increases how much of this raw material you are providing consistently. The third ingredient is extra virgin olive oil. This is where precision of language matters. Not olive oil generically. Extra virgin olive oil, cold-pressed, stored in a dark bottle away from heat and light. The distinction is real because extra virgin olive oil retains a compound called oleocanthal that refined or light olive oil does not contain in meaningful amounts. Oleocanthal is a natural phenolic compound that inhibits the same CO-CUX enzymes that ibuprofen inhibits, through a closely related mechanism. The difference is that ibuprofen provides a concentrated acute dose, while olive oil provides a consistent lower-level signal across every meal, reducing the background inflammatory environment in which plaque initiates and grows. The PREDAMEN trial, one of the largest cardiovascular nutrition studies ever conducted, followed thousands of high-risk adults for years comparing a Mediterranean diet supplemented with extra virgin olive oil against a low-fat control diet. The Mediterranean diet group experienced a 30% lower rate of major cardiovascular events. That is a meaningful number from a well-designed long-term trial, and extra virgin olive oil was one of the key distinguishing elements. Use it as the primary cooking fat and the base of every dressing. The practical guideline for label reading: look for cold-pressed with a harvest date, and store it away from heat and direct light to preserve the oleocanthal content. The fourth ingredient is raw garlic. The active compound in garlic that matters most for cardiovascular health is allicin, and allicin only forms when garlic is crushed or finely chopped and then allowed to sit for approximately 5 minutes before being exposed to heat. High heat deactivates allicin before it is absorbed, which is why the preparation method matters as much as the ingredient itself. Working raw crushed garlic into a cold olive oil and lemon dressing, added to the plate right before eating, is the most practical way to preserve allicin's activity. Allicin works through 3 relevant mechanisms. It reduces inflammatory signaling in arterial walls, contributing to the same goal as olive oil, but through a different biological pathway, which means the 2 compounds are additive rather than redundant. It mildly reduces platelet aggregation, making blood cells slightly less sticky, and therefore making it harder for a dangerous clot to form, even if a soft plaque does rupture. And multiple randomized controlled trials on aged garlic extract have shown measurable reductions in new plaque progression, and in some early-stage cases modest regression. The fresh garlic in a meal provides the same active compound in a less concentrated form. 1 to 2 crushed cloves, sitting for 5 minutes before mixing into the dressing, is the practical application. The fifth ingredient is berries, or pomegranate. Blueberries, strawberries, raspberries, blackberries, and pomegranate seeds are among the most concentrated dietary sources of polyphenols, a broad class of plant compounds that address something specifically called LDL oxidation. This distinction matters more than most people realize. LDL cholesterol on its own is not the primary villain in plaque formation. Oxidized LDL, LDL that has been chemically damaged by reactive oxygen species in the arterial environment, is the form that initiates the inflammatory response and begins sticking to damaged artery walls. Polyphenols act as what food scientists call reactive oxygen scavengers. They neutralize the oxidative environment that allows LDL oxidation to occur in the first place, which reduces how much new plaque has the conditions it needs to begin forming. Pomegranate specifically has early human study data suggesting improvements in blood flow and arterial flexibility over time. The research base for pomegranate is still developing compared to the broader evidence for berry polyphenols, so it is worth treating the pomegranate data as genuinely promising rather than established. Either a handful of mixed berries or half a cup of pomegranate seeds serves the same basic purpose. Frozen berries are nutritionally equivalent to fresh and substantially more affordable. A bag of frozen mixed berries from any grocery store is one of the most cost-effective polyphenol sources available. The sixth ingredient is ground flax seeds. This is the one that consistently generates the most surprise, and the mechanism behind it is worth explaining clearly. Whole flax seeds pass through the digestive system almost entirely unabsorbed. Ground flax seeds release their contents, and what matters most for arterial health is the soluble fiber they contain. Soluble fiber dissolves in the gut and forms a viscous gel. That gel physically binds to LDL cholesterol in the digestive tract before it can be absorbed into the bloodstream, and carries it out of the body through normal elimination. Less LDL entering circulation means less LDL available to be oxidized, which means less of the oxidized LDL that initiates plaque formation reaching artery walls. Beyond the soluble fiber, flax seeds contain plant-based ALA omega-3 fatty acids and a class of compounds called lignans. ALA is the precursor to EPA and DHA, though the conversion rate in the human body is low and variable. The lignans have demonstrated antioxidant activity in research and appear in studies on cardiovascular health, particularly in the context of postmenopausal women, though the mechanisms are still being actively studied. The practical rule is simple: 1 tablespoon of ground flax seeds sprinkled over the meal immediately before eating. It has almost no detectable taste, but its effect on LDL clearance is measurable in blood work over consistent use across weeks and months. What to remove from the background? Building this plate consistently produces its best results when it is not being undermined by 3 foods that routinely appear in people's diets under a health food label without deserving one. Flavored yogurt is the most common example. The base is genuinely nutritious, but most commercial flavored varieties contain enough added sugar to actively feed the oxidative and inflammatory environment the meal above is trying to quiet. Plain full-fat Greek yogurt with berries added at home gives you the probiotic and protein benefit without the sugar load. Granola and commercial breakfast bars follow the same pattern, often marketed as heart-healthy while being primarily sugar in more expensive packaging. Reading the ingredient label rather than the front panel is the reliable test. And fruit juice, even varieties labeled as no added sugar, delivers the natural sugar from fruit in one concentrated dose without the fiber that makes eating whole fruit metabolically manageable. An apple is genuinely good food. Apple juice is sugar water with effective branding. None of these foods are catastrophic in occasional use, but eaten daily as background habits, they continuously feed the oxidation and inflammation the 6 ingredients above are working to reduce. The honest framing: this meal is real food science applied consistently. The mechanisms behind each ingredient are well documented. The studies cited are legitimate, and eaten regularly. This plate creates an internal environment that is meaningfully less favorable to new plaque formation and more favorable to plaque stabilization. That is a real and valuable outcome. What it is not is a complete solution to established cardiovascular disease. Arterial plaque develops over years through a combination of diet, blood pressure, blood sugar, sleep quality, stress hormones, genetics, and other factors. Food is one of the most modifiable of those factors, and one of the most powerful tools available. But a plate of salmon and greens does not operate in isolation from the rest of a person's physiology. If your cardiovascular risk has been identified by a clinician through blood work, imaging, or clinical history, the conversation about what intervention is appropriate belongs with that clinician who knows your complete picture. What this plate does is give your arteries the best possible dietary environment at every meal you choose to eat it. And given that every meal is either pushing in a direction that supports arterial health or in a direction that undermines it, the choice of plate is never neutral. Wild-caught salmon, leafy greens as the base, extra virgin olive oil with raw crushed garlic as the dressing, berries or pomegranate on the side, and ground flax seeds sprinkled over the top. Every ingredient earns its place. The science behind each one is solid, and consistency across weeks and months is where the benefit actually accumulates. This content is for general educational purposes only and is not a substitute for personalized medical advice. If you have existing cardiovascular conditions or risk factors, please work with your healthcare provider before making significant dietary changes.